In this video, I will be going over the electrical activity of the heart and its relationship to the visual representation of an EKG, as well as how it influences heart rate during exercise. Before understanding heart rate and the cardiovascular system, it is important to first understand the electrical activity of the heart and the intrinsic factors that allow the heart to contract. Knowing these intrinsic factors will allow us to better understand and visualize contraction mechanisms of the heart, as well as how heart rate changes during exercise. The heart is a muscle similar to many other muscles that we have. However, unlike any other muscle in our body, the heart has the ability to contract on its own. This is due to the unique potential of myocardial cells to produce spontaneous electrical activity. This spontaneous electrical activity occurs because of a decay in resting membrane potential via an inward diffusion of sodium during diastole. An action potential originates in the SA node, causing a wave of depolarization once the threshold is reached. This depolarization wave spreads along the atria, causing it to contract spontaneously. Since the depolarization wave cannot directly reach the ventricles, it is instead transported via a conductive tissue called the AV node. This tissue is located at the base of the right atrium and connects the atrium with the ventricles through other conductive pathways called the left and right bundle branches. The depolarization wave passes through the AV node and along the bundle branches that are located in the intraventricular septum, and to the Purkinje fibers that ultimately cause ventricular depolarization or contraction of the ventricles. In all, there is about a 0.10 second delay between atrial and ventricular contraction. This delay is important because it allows blood to enter the ventricles before they depolarize. During exercise, heart rate increases rapidly. This is due to a withdrawal of parasympathetic tone and increased stimulation of the SA and AV nodes by sympathetic fibers that release norepinephrine, which ultimately cause an increase in heart rate and myocardial contraction. This figure is a visual representation of the heart's electrical activity. The P wave, QRS complex, and T wave all represent the depolarization and repolarization phases of both the atria and the ventricles. In this figure, we can see the relationship between the electrical events of the heart and an EKG. The P wave represents an action potential that causes the atria to depolarize and contract. The P wave is followed by a short repolarization or resting phase, and it is during this time that the ventricles fill with blood. Following the P wave is the QRS complex, which illustrates ventricular depolarization. The T wave then represents the repolarization phase of the ventricles. The QRS complex represents ventricular systole and rise in pressure is shown. The T wave occurs as the ventricles relax, representing ventricular diastole.